Hi guys, Dr. Parko here. You're going to get the chance to possibly work on some children over the next week. So we need to learn how to do a coronal polish because that's a service that we can perform on their teeth to remove some of the plaque. It helps us get a better idea of what might be underneath that plaque, along with removing some of the stains. If a child's never had a cleaning before, it will be pretty impressive to see what we can do with these teeth after just a basic Prophy or what we're going to call a coronal polishing. You're going to need to know some of the equipment that we use. I'm going to show you how on this video that we put it together and some of the supplies that are needed to perform a coronal polish. So let's get to the video. And if you have some questions at the end, I'll be glad to share my ideas and talk to you about it at that point. Notice is that we're going to use a nose cone today when we're doing our coronal polishing. You're also going to use your Prophy angles. We have two sizes. One's going to be what you would typically use for an adult, which could be used in a child in many instances, as well as you could use the Prophy angle that has a smaller cup on it. Prophy paste, which is, this is a fine granular paste. This one I believe has a bubblegum flavor, even though it's orange, and a disclosing tablet. And a disclosing tablet is something that's a child will chew on, or any of us can chew on, and what it does, it stains the plaque, and therefore when you start to do your Prophy, you can see the plaque more easily and remove it based upon the stained color that it is. So those are the few of the things that we're going to start working with this morning. You may notice that on your nose cone, there is a metal piece that sits on top of it that needs to be removed before you can put the Prophy angle in. Grab your Prophy angle and insert it into the top of the nose cone. From there, you can take your nose cone and insert it onto your motor. Okay, so today you're going to be using your attachment, your nose cone. Your nose cone, as we said, sits on top of your motor. You want to turn your nose cone the top ring counterclockwise, and what you're going to have is your Prophy angle. The Prophy angle, you situate it, you put it right inside of your nose cone, push down, and once it's in, you turn your ring clockwise, and that will lock it into place. Here's your Prophy paste. As we talked about, this is the fine Prophy paste. In most every instance, you're going to be using the fine Prophy paste because we don't want to take too much enamel off the tooth each time that a patient comes into the clinic. But when you do have heavy staining, you want to use the coarse. But for today's example, we're going to be using the fine. The fine in this particular brand comes in an orange color, and this one tastes like bubble gum. Smells delicious, smells like bubble gum. And the purpose of a Prophy, of a coronal polishing, is really twofold. One is to remove the light plaque and to remove light staining on the child's teeth. Oftentimes orthodontic offices will use it so they can clean the tooth surface prior to bonding to it. But now that we have the Prophy angle attached to your handpiece, we want to pick up a little bit of the Prophy paste inside of the cup on the Prophy angle. So we want to start with just a light pressure. Now I'm going to press on the rheostat. I'm going to see if you guys can hear this sound. As we press hard on the rheostat, it actually spins it tremendously fast. Actually, it spins it so fast that it will break your Prophy angle. And I've done this twice now. So we want to show you that if you have your unit set at the wrong speed, you can actually break the gears off of your Prophy angle. So the doctor will show you here the adjustment that you need to make. It looks like we need to go to 3,000 RPMs. So what you'll want to do is if you follow these steps, this will help you get into the 3,000 RPM setting that you'll need today for your coronal polishing.
So you just go to different RPMs here and select 1500 and click OK. And once you have it, then we can click on the right arrow here just to increase up to 3000 RPM. And I think that's probably a best RPM that you could use for this. That's it.
Very good. So that'll be the setting that we use today for the coronal polishing. We are going to use our pediatric typodonts today. You're just going to do this on the bench tops. And the first thing you'll do is take your Coronal Polishing handpiece and you're going to scoop out and fill the well that's in the cup. Each time you fill this, you can do 2 or 3 teeth. Now I'm going to suggest that what you do is you have a pattern as to how you go about doing this today. You may want to start on a child who just has their primary dentition on tooth A and work it on the buccal surface, remembering that the purpose of the coronal polish is to remove stain, remove light stain, and to remove light plaque. Move it up to the next tooth. As you press on the tooth, the cup will flare, and it might lightly go below the gingival margin, and that's okay. You don't want to go deep below, but if you just happen to go slightly below, that's okay. Notice the speed of the handpiece. We've adjusted it so it won't generate too much heat, but what you don't want to do is generate too much friction by putting too much pressure on the tooth by being heavy-handed. So just put enough pressure to remove the plaque and to remove the stain. Once you're done, you can go back, fill the well or fill your cup again with your Prophy paste and go to your next tooth. Since we're following a chronological order, A through J up top, we'll go to tooth C here. We'll try to find the interproximals as well, getting the facial surface, going slightly to the mesial interproximal, the distal, going to tooth D. We've done a few teeth at this point. It looks like we're running out of Prophy paste. We reload again. It would be helpful if your assistant would hold on to your Prophy paste so you can just keep going back to the well and dipping as necessary and not having to pick it up yourself. You finish up with the facial surface on tooth E. Now would be a good time to rinse, because you can imagine as you're building up Prophy paste in the mouth, the child will be developing a little bit of saliva in the back part of their mouth, and some of the granular Prophy paste may find its way to the back part of the mouth. So rinse at this point in time and give the child a chance to take a break. Next, what you'll want to do, after we finish this quadrant, you'll get some Prophy paste and you start doing the occlusal table, getting each of the cusps, running it through all the cusps. We're going to reload our cup, and then we want to do the lingual or the palatal surface as well. For today's example, and since it's your first time you're going to be doing this, I think it'd be great if you started with the upper arch. Kids oftentimes can gag and the tongue is more difficult to work around, so start with your upper arch. Again, if the camera can pick this up, we're running up underneath the gingival tissue ever so slightly, taking the Prophy cup as it expands and both into the buccal and lingual interproximal areas. Once we've removed all the plaque, the light plaque and the light stains, it's time to rinse, and we'll go on to the next quadrant. Remember that safety goggles are always important, not only for yourself, but for your patient, because Prophy paste will be flying out of their mouth and will possibly end up in their eye without some eye protection. So make sure you put eye protection on your patient before we start this morning. So as we look through the varieties of Prophy paste that are going to be available to us, we have the mint flavored, which is a medium grit. We have cherry burst, sounds delicious, but that's in a coarse grit. And then we have the bubblegum that's in the fine grit. Flossing, a very important part of the coronal polishing process since they're here today for that reason. You're gonna get the floss, wrap it around 2 fingers so it's nice and stable, and then you're gonna actually go through every interproximal contact, holding the floss against the mesial surface of the tooth, bringing all the plaque down, going to the adjacent tooth on the distal surface and bringing that down as well. Remember, you are focused on getting your job done, but there's a child that's attached to those teeth, so give them a break every once in a while. Stop, rinse, put the slide ejector in their mouth and just ask them to close down. Once they close down, it'll suck out all the saliva, and you might prepare them to let them know that when they close down, it's gonna feel a little funny. Is about disclosing tablets. Disclosing tablets are nothing more than something that a patient can chew on, and it's going to reveal where the heavier plaque is, because the plaque gets stained more easily than anything else in the mouth. It'll actually, I chewed one just a moment ago, you might see a little bit of purple on my teeth just from that. We're gonna do it again. And so what we're gonna do is you just take a tablet, single tablet, we open it, because I just did this, I know that they taste delicious, but here's what's important, especially when you're working with the kids. It's natural that if you eat something delicious, the child is gonna wanna swallow it. We don't want the child to swallow it. You're gonna ask them to hold it in his or her mouth after they chew it. So they're gonna chew it, have them move that saliva around their mouth so it can stain all the plaque. Because I know I'm making an example of this, I'm trying to build some saliva up in my mouth. And then what you're gonna see is the purple staining in the areas that need to be polished off. So it'll make your job a little bit easier today because you can identify those areas with the heavier plaque on it. Next, we want to show you that we have a light on the piezo scaler, correct? That we are going to, that you might be able to pick up the color difference a little bit more easily. So let's do that next. So, and they have this in the clinic?
Yeah,
Okay. So you have a light in your, a light in the clinic. It is this particular light that if you shine it on someone's teeth after they've chewed the Disclosing tablet, it'll, let's see what it does. What you seeing, Doc? What you seeing?
We're seeing the purple stain really well here because there is a light that is coming through this piezo handpiece. And you can do your cleaning better with this kind of an aid.
Very good. So after the child stains their teeth, or you stain the child's teeth, go ahead and use that light to get an idea of where all the stains lie. Another important point that we want to briefly discuss is that a coronal polishing is just that. You're polishing the crown of a tooth. You're not polishing the root surface. And so please don't transfer the information that you learned today thinking that everything that's exposed into your adult patients that you need to polish that. It only goes down to where the enamel stops. That's what the purpose of the coronal polish is. Going onto the root surface could be sensitive to the patient at the time, could cause some sensitivity, so just be aware of that. Coronal polishing is polishing the crown of the tooth. So as we mentioned, today we're going to work on the bench top on your pediatric typodonts to start with, and then we're going to partner up and you're going to be performing a coronal polish on your partner. So let's go ahead and give you an example and show you how that's going to happen with using me as a live patient, just as an example how we're going to clean off some of the disclosing solution that we just applied.
All right, there you go. I got a rubber cup here with all the Prophy paste. Okay, let's try. Okay, we start on the buccal surfaces and then keep moving, and then try to reach the interproximal and then go to the other interproximal surface. And that's it for the buccal. Now next you can move on to the next tooth. Once again on the buccal, and then keep moving towards the interproximal, both on the mesial and distal. That's it. That's how you do this.
Very good.
Should I do that? Okay, here we're doing on the other side, on the left side here. Okay. Perfect. And make sure that this is rotating at 3000 RPM, nothing more than that. That's better.
Remember, thank you, doctor.
Can you just clean and then show it to them that it's been cleaned? Can you focus? Now you can look at the central incisors and laterals, how we remove that purple stain. That tells us that we remove the plaque on those surfaces.
Very good. So the stain is gone, therefore the plaque is gone. Also, did you notice he had a very soft hand? He didn't put a lot of pressure because too much pressure will generate heat and that will cause pain in your patient. So make sure if you're going to err on the side of being too light to begin with. And if you're trying to get a stain off, come to the stain, put a little pressure, move away from the stain, come back to the stain, try to remove it that way. Don't continue to keep your coronal polish, the head of it, on the stain because it'll generate too much heat over a short period of time. So we are using a product in the clinic called Embrace Varnish. This is 5% sodium fluoride. And we're going to show you the technique on how to apply it after you have finished your coronal polish and your flossing today on your pediatric patient. Open up your packet. Two things will be inside that packet. The fluoride itself. This is called the fluoride varnish. Okay, this is a little bit different than maybe some of you have used when your childhood years, where you would sit with a tray in your mouth. This is going to be applied with a small brush. I'm going to open it up. Once it's open, he's going to use the back of his glove as I call like a canvas, like you're painting, and we squirt the varnish onto the back of his glove. From there, he's going to load it onto a small brush, and what you want to do is have your patient swallow. You don't want to dry the teeth. You want them to have a little bit of moisture on them. He's going to retract my cheek a little bit and then run the brush that's loaded with the fluoride across the buccal and facial surfaces of the teeth, and then that varnish will find its way into the interproximal areas. And I want to make sure you know, please do not continue to paint the tooth, because if you do, it will leave a very rough surface of varnish, which will be uncomfortable for the patient. So one-time application, taking it across the buccal and facial surfaces, and then work your way around the mouth. You don't need to put it on the occlusal tables. You don't need to put it on the linguals. You just need to do the buccal surfaces all around. So here we go.
All right.
I swallow first.
So I'm just using this brush just to get some varnish, and use a mouth mirror just to retract the cheek and make sure that you visualize what you're doing. And we go, and then we paint in one go. And it is all just one go, okay? Don't paint it twice. And I'm just crossing the midline and going towards the left side and following along. That's it.
Remind your patient not to eat or drink anything for 30 minutes after the application of the fluoride varnish.